So, boss, in our business, we also deal with a lot of arthritis. There's a couple types we primarily deal with, right? One we like to call wear and tear arthritis, and the other one would be an inflammatory type arthritis. Would you describe and talk to us about those, please?
Oh, sure. Many people come to us saying they have a diagnosis of rheumatoid arthritis and actually do not, or they may have it, but that's not the major source of their pain. But let me briefly describe the differences. Wear and tear arthritis is typically when a joint is out of alignment and it wears out on one side of the joint more rapidly than another. Very similar to if you had a car tire that was tilted out too far, the outside edge or the inside edge may wear out faster, right?
Absolutely.
That is osteoarthritis or wear and tear arthritis. There's several other conditions that can cause destruction of a joint, and those are typically what we call autoimmune disorders, where you can destroy your own joints by your own immune system. There's many diseases like that. You've heard of rheumatoid arthritis. That's one of the inflammatory arthritises. You could also have psoriatic arthritis with psoriasis, and you could actually have psoriatic arthritis without skin changes. It typically shows up as pitting of the little tiny pits in the fingernails, and it has a propensity for the distal joints of your fingers and the base of your thumb. Whereas wear and tear arthritis can be at every joint in the thumb. It's where fingers are gnarly and they turn in different directions, and often at the base of the thumb as well.
Absolutely.
You could have lupus, you could have gout, and where crystals are deposited into your joints, a highly destructive and painful condition. It can present almost like an infection with significant pain, redness, swelling, and a lot of people will call us and say, we have a person with an infected joint. You've had one the
Right,
other
I have
day.
one today.
And it's not an infection, it's really a very angry, gouty joint, and just a simple injection can put the fire out completely.
And that's exactly what I did.
Right. So, so even if you have a known diagnosis of wear and tear arthritis, you may actually have signs of rheumatoid arthritis as well, which almost always shows up as swelling as these two joints of the knuckles. Rarely these two, but always these two. And so that's a good hint that you have rheumatoid arthritis.
All right. So if you're out there and your hands are hurting, you note nodules in your hands, you're having difficulty moving them, especially in the morning, they feel stiff and have problems such as that. That's very likely an underlying arthritis of some sort. So why don't you come see us here at Carolina Regional and let us make that diagnosis and help you get better.